In the causes of dyslipidemia or hyperlipidemia, where there is a presence of what high levels of triglycerides and high levels of what low density lipoproteins, we said that the causes could be divided into the primary causes and the secondary causes. Now, for the primary causes, we said that it could be due to some genetic stuff, right? You were just born with it, okay? Then secondary causes is just basically some lifestyles that you practice, some foods that you eat, okay? Some pattern that you do that your body don't actually like it, or your body likes it for some time, but you have to pay when you get old, okay? So those things are secondary. They are not primary. You weren't born with it, okay? So we'll get to look at the secondary causes of what hyperlipidemia. This is us still talking about dyslipidemia, still the same thing. So I think we'll use this one for summary. Let's go into the lecture full time. We said that what secondary causes of hypercholesterolemia or hyperlipidemia. This thing has so many names. We have things like what hypothyroidism, cholestasis, some drugs that are taking like diuretics, cyclosporins, and corticosteroids. All of them have a tendency of causing what high levels of what cholesterol in the body. Then anorexia nervosa, nephrotic syndrome, porphyria, all these conditions can what be like secondary triggering things, okay, that will cause lipid levels in the body to go up. All right. Then this was more of like cholesterolemia, which is just cholesterol, right? So now looking to at what hypertriglyceridemia. So that's more of like now we're talking about what will cause triglycerides to increase in the body. All right. So obesity. If somebody's so big, can I say somebody so big, it will cause what? Hypertriglyceridemia. Okay, then if somebody has a type 2 diabetes mellitus too, it's a predisposing factor. If you take binge alcohol, all right, you drink to stupor, it's a predisposing factor. Hepatitis, if your liver has a problem, it's a predisposing factor. If you have chronic renal disease, it's a predisposing factor. Then if you take some drugs like what beta blockers, corticosteroids, and retinoids, all of these are what causes for hypertriglyceridemia. This one was causes for what? Hypercholesterolemia. So if you combine the two of them together, that's what they call what? Hyperlipidemia. Okay, so that's it guys, and bye for now.